Okay, before I start this video, I'm going to scan my room in 360 degree, and my camera is in the selfie mode. Okay, knock knock. So before I start, I'm going to provide a hand hygiene. Clean my hands with hand sanitizer. Hi Kyle, my name is Princess and I'm a student of United States University, and today I am going to do the HEENT assessment on you. Okay, before we start, is it okay for me to get permission from you to record this video and put it on YouTube as unlisted so that my professor can view?
Yes, I consent.
Okay, thank you. So I am going to start from the head and work my way down from the head, okay? So I will check for the hair distribution, which is even, and there's no hair loss, okay? And the texture of the hair is coarse and appropriate to ethnicity, okay? It is normal for the patient. Okay, and I'm going to assess the head, and the head is symmetrical and there is no deformity. Have you had any trauma?
No.
And there is no visible masses, no lesion, no cysts noted. Okay, and I'm going to palpate, okay, to check for mass. Okay, to check for masses, any tenderness, any deformity. Does it hurt when I palpate?
No.
Okay. And then I am going to assess the patient eyes now. Okay, so I am going to check the eyelid, okay, and there is no ptosis, there is no excessive drainage, okay, and open your eyes, and the sclera is white, there's no sign of jaundice, okay, and the conjunctiva is open for me, is pink and moist. Okay, I am going to now look into the patient eye. Okay, I'll be checking for the pupillary constriction. Okay, so I will do the direct and the consensual test. Okay, so I am going to look into your eyes. So right now I am going to do the direct test. Okay, open for me. So the pupil constricted and reacted to light. So the pupil is constricted and reacted to light. So this is the direct approach, and I'm going to do the indirect approach. Okay, so for the indirect approach, which is the consensual approach, so I will look into the eye and see the reaction on the opposite side. Okay. Okay, and the pupil constricted to light, which is normal. So next I am going to do the Snelling test, okay, for the visual acuities. Okay, so I will, if I had a wall chart in a clinic, it would be like 20 feet away from the patient. And since like this is a card, the card will be like 6 feet from the patient. And since this is for educational purposes and I have to be in sight of the video, so I will ask the patient to close one of your eyes. Can you close your left eye? Okay, can you read the smallest number you can see?
LTFPH.
Okay, so patient vision is 20/20 and corrective. Can you close the other eye? Okay, can you read the smallest number you can see?
LTFPH.
Okay, so patient Vision is 20/20 and like corrective. Can you read with your both eyes?
LTFPH.
And patient vision is 20/20 with both eyes. Okay, now I am going to do the extraocular motion and I'll be checking for cranial nerves 3, 4, and 6. And cranial nerve 3 is the cranial nerve 3 is the cranial nerve 3 is the oculomotor nerves, and the cranial nerves 4 is the truncular, and the cranial nerve 6 is the abducing. Okay, so Kayo, I'll ask you to follow my fingers, okay? With your eyes, not with your head, okay? So follow. Okay, so this is the 6 cardinals, okay? Okay, so this is the 6 cardinals, and I'm going to do a accommodation test. Okay, can you look behind me? Okay, and follow my fingers, okay? Okay, so with the accommodation test, the patient, when the finger is near the patient, you see that the pupil constrict, and like when it's far, it does dilate. And I'm going to do the confrontational test. Okay, follow my fingers. Okay. Okay, someone with the confrontational test, you see that the eyes crosses, which is normal. Okay. So I am going to look inside your eyes. Okay. So with the eyes, I am going to check the patient eyes. Okay. So normally I will use my right hand, right eye towards the patient right, okay, and left hand, left eye to the patient left eye. Okay, so I am going to look, open your eyes for me, and I'm going to support the patient, and as soon as I see the red dates, okay, I will go like 15 angle. Okay, so I will look into the patient eyes. Okay. And now left eye, left hand, and the patient left eye. Okay. So I am going to look at the optic to the eyes. Okay. Normally you see the optic disc has a sharp margin with yellow, orange, creamy. And the capital disc is 1:3 ratio, and the arteries are smaller with light red, and the veins are larger with dark red, and you can see the fovea and the macula in both eyes. So as I look into the eyes, I did not see any sign of infection. There's no excess drainage. Open your eyes. There's no excess drainage. The sclera is white. The conjunctiva is clear. Okay. And next I am going to assess the patient nose. So with the nose, I am going to, you look tired, eh? With the nose, I am going to look at the shape of the nose. The nose is symmetrical. I don't see any deviation. It's in the midline. I don't see any masses. I don't see any lesion. I don't see any drainage. And I'm going to palpate for the sinuses, the frontal sinuses and the maxillary sinuses. Okay, so I am palpating the maxillary sinuses. Is there any tenderness?
No.
And I'm going to palpate for the frontal sinuses. Is there any tenderness?
No.
Okay. So I am going to look inside your nose. Okay.
Okay.
Okay. Okay. Okay. So I will look inside both nose, and I don't see any excessive drainage. The nose inside the mucosa is pink and white. There's no deviation noted, and there is no sign of infection. Okay, and now I am going to assess for the cranial nerves. Is the cranial nerves 8, I believe. Okay, so we are going to do the smelling test. Okay. Oh, first of all, let's do the airflow in your nose. Okay, I will ask you to block one of your nose and take a deep breath. Someone, can you block your right nose and take a deep breath? Okay. And as patient breathe, I can see a good airflow. Okay, a good passage. Can you block the other nose and take a deep breath in and out? Okay. So there's a good airflow. Okay. So I will, now we will do the smelling test. Okay. I'll ask you to close your eyes, and I will give you some stuff to smell and tell me what you can smell. Okay. What can you smell? What are you smelling?
Ginger.
What are you smelling?
Curry.
Okay, yes, good. Okay, good, thank you. So, did I palpate your sinuses? I think I did, right? Okay. So, I am going to now assess the ears, okay? So the ears is symmetrical and the size is appropriate to body size, and I don't see any visible masses. There is no lesion. Okay, there is no lesion, and there is no lesion. I don't see any excessive drainage, and I'm going to palpate the ear. Okay, so I am going to palpate. Is there any tenderness?
No.
Okay, and I'm going to pull down the triangles. Okay, is there any tenderness?
No.
Okay, and I'm going to look into the patient ear. Okay, so normal. So with this, I have to be careful for safety reasons. So I have to support the patient head and also with my hand so that the patient will not get hurt. Okay, so I am going to look into the patient right ear. Okay, so with an adult patient, you will pull up and look, but with kids, you will pull down and back. Okay, so in the right ear, the with the light, you go 5 o'clock, and the tympanic membrane is fairly gray, and I don't see any sign of redness. There's no arrhythmia, there is no drainage. Okay, and I'm going to go to the left ear since this camera is in the selfie mode. So so this is the left ear. Okay, and I'm going to go like 7 o'clock, and the tympanic membrane is fairly gray, and there is no arrhythmia, there is no sign of infection, there is no drainage. Do you have any pain in your ears?
No.
Okay. Oh, before I move on, so when I did my eye assessment, I did not see any ptosis, I did not see any nystagmus, and I did not see any exophthalmos, like which is the bulging of the eyes. Okay, so now I am going to look into the patient mouth now. Okay, and now I am going to inspect the lips, and the lips is pink and moist. There's no crack. There is no crack. It's pink and moist, and no masses, no lesion. Okay, and I'm going to ask you to open your mouth. Open up for me. Can I open?
Excuse me.
Okay, so I am going to look inside the patient mouth. So mouth is the mucus is pink and moist. I don't see any arrhythmia. I don't see any sign of infection. Good dental hygiene. I don't see any abscess. And the gums are not inflamed. Teeth are intact. There's no missing teeth. There's no cavity. And no sign of infection. Okay, just do for me. Okay, and the uvula moves up and down, and the tonsillar is +2. Papillae, pull out your tongue for me. Papillae is 1.1 millimeters. Okay, and it's okay. Put your tongue back. Okay. And say again. Let me look at the back of your throat. It's a little bit red. It's a little bit red. Okay. And so those are the cranial nerves 9 and 10. 9 and 10. Okay, the 10 is the vagus, and the 9 is the glossopharyngeal nerves. Okay, and I don't see any just a little bit redness at the throat. Okay. Now I am going to do the neck exam right now. Okay, so Kyle, I am going to look at, there is no deviation. I don't see any masses, I don't see any lesion, and it's appropriate. And the neck is in midline. The thyroid is in appropriate place. Can you shrug your shoulder for me? Okay, so it's appropriate and even. I don't see any deformity. Okay, and I will now palpate for the lymph nodes. Okay, I am going to start from the preocular, okay, posterior ocular, okay, and I'm going to go down to the occipital and for the lymph nodes. Okay, I'll be checking for any masses, any polyps, any thing. And I'm going to, this is the tonsillar, and this is the submandibular, submental. Okay, and I will come to the okay, so and I will come to the anterior cervical, posterior cervical, and supraclavicular lymph nodes. Okay, and I'll come to the patient back, and check for the swallow. I'll be doing the swallow test. Okay, can you I will palpate. Normally you will palpate the thyroid and the neck for the masses or anything. Okay, and I'll put my hand to check for swallow. Can you swallow for me? Okay, so the thyroid moves up and down appropriately, and looking at it, I don't see any swelling, I don't see anything. Okay, so now I forgot to do the hearing test, okay, which is the Weber test and the Rene test. Okay, so with the Weber test, we use the Weber test to check for conduction, and is to use for checking for like hearing loss. Okay, both Weber and the Rene test. Okay, so I'm going to do the Weber test now. Okay, so I'm going to put this on the patient forehead and ask the patient if the patient can hear in both ears. Okay, so I'm going to do it now. So can you hear this in both ears?
Yes.
Okay. Or just one ear? Both or just one ear?
Both.
Okay. And I'm going to do the Rene test, okay, and I'll put it at the back of the patient ear and ask the patient if like he can hear. He can, if he should let me know if he can no longer hear. Let me know if you can no longer hear.
I can no longer hear it.
Okay, now can you hear?
Yes.
Okay, so I will test the same place. Wait. Okay, so tell me if you can no longer hear.
I can no longer hear it.
Now can you hear?
Yes, I can hear it.
Okay, so hearing is intact. Yeah, I forgot to do this assessment when I was doing the hearing part of it, which is the cranial nerves 8, which is the what's the name? Vest. It's hard for me to pronounce it. Vestibular ocular nerves, which is the cranial nerves. Cranial nerves 8. Okay, so I don't know what else I'm missing in this assessment, but I just want to stand a little bit to see if there is anything I'm missing. I think this concludes our assessment. And Kayo, thank you once again for allowing me to do this HENT assessment for my class. Okay, thank you.
Mm-hmm.